Hello, I wasn't going to make this video, but then I saw a news story a couple of days ago or a day ago that was about a former member of the group Kansas that died recently, Robby Steinhardt, who was the violinist and also a singer for that group. Of course, the group Kansas, the classic rock group that released such hits as Dust in the Wind, Carry On My Wayward Son, The Wall, a bunch of stuff. Just a really good classic rock band. But what caught my attention was that when I was looking at the article about Robby Steinhardt, it said that he had died of acute, or rather, complications from acute pancreatitis. And on this same, earlier, I don't know, it's probably been about 4 years. No, not that long, maybe 2 years. I released a video myself about chronic pancreatitis because like I said, this artist died from complications from acute pancreatitis, and I made my own video about pancreatitis because I was also diagnosed back in, was it 2019? Yeah, I went to get the endoscopic ultrasound with chronic pancreatitis, and I've had acute pancreatitis. It's really a very painful disease. It's probably up there with the most painful thing that I've ever experienced. I think the only thing that was worse was that after I had my gallbladder removed, I got home and I ate my first true meal, and then I started just feeling this burning inside, and but I had a bile leak, so I got I think it's called biliary peritonitis, and that hurt probably worse. But that's the only thing that I've had that hurt worse than acute pancreatitis. I had my first attack from a viral infection when I was 17 years old, and I've had lots of things. I've had many dental abscesses. I cut my hand really bad with a chainsaw, and none of that even came close to the pain that you experience typically with acute pancreatitis. It's just awful. But I wanted to make this video because one thing that I've seen, I do belong to a support group for chronic pancreatitis, and it's been pretty hard for people with that, and actually chronic pain patients in general, because I know during the last presidential administration there was a lot of attention focused on the opioid crisis, and of course there were a lot of people that were having problems and a lot of overdose deaths and stuff like that. But I think that one of the, I guess you could say it's almost like collateral damage from all of that were the legitimate pain patients. And so what's been happening and what I've seen with, like, just within my support group, the chronic pancreatitis patients specifically, is that they're being weaned off of their pain medications, and they're more or less being pressured to have these really high risk, poor outcome procedures. And in fact, just like every couple of months or so, I'll see a notification that another person that's in the support groups actually died. And many of these people are having a procedure done where they actually take their pancreas out, and then they inject islet cells back into the liver. And I think the idea is that these islet cells, or islet cells, I'm not sure how you pronounce it, are supposed to then start producing insulin. But what actually seems to be happening is that these people are developing a really brittle form of diabetes, and they're dying like... in fact, I was reading about one guy. He was a famous New York policeman or something that was in the news. I think his name was Ryan Finley. And they were using him as a poster boy, essentially, for this procedure. He had to leave his job because of the debilitating pain and this and that and the other. And so he had this procedure done somewhere, as best I can figure out, somewhere around 2014. He had his pancreas removed. And then I noticed, I think it was last year, I saw that he had died. So what's happening is that a lot of these people are having these really high risk procedures done, and they're dying. So um, I just wanted to give this update. In my case, it's a milder form, so I'm able to manage it better. But it seems like it's a real problem. I mean, it's a disease where you don't have a lot of viable options, and so unfortunately, I think people get to the point where they just will do almost anything to be out of pain so they can live a productive life. But then, unfortunately, what's happening is they're having these procedures that when you look at the long-term outcome, it's not very good, and so this is something I noticed. But anyway, what made me think of this was when I saw the article about Robby Steinhardt. And I've heard this seems like it's becoming more prevalent because I also had read that the actor George Clooney had developed acute pancreatitis, and I can't remember what in his case the cause was. I think he was on a really weird diet because he was making a movie or something like that, and that triggered an attack. But it's a disease that's it can be really bad to get. I mean, it's typically one that affects people that drink a lot, but I think that also leads to some stereotypes because I think, I've heard of people, and even in my case, I've never been an alcohol drinker, but when I was 17, that's when I had my first attack of acute pancreatitis. I spent the next 2 weeks or so in the hospital, and it didn't have anything to do with drinking alcohol. What happened was that I got a viral infection, and somehow that triggered this acute pancreatitis. So the other thing that I've seen that's really sad about this disease is that people go to the hospital and they'll have pancreatitis, and they'll be looked at with suspicion as if they're like, guzzling alcohol or whatever, because it's assumed that that's like the only cause of the disease. But actually, there are several other causes as well. There's some genetic mutations that can cause both acute pancreatitis and chronic pancreatitis. Gallstones can cause it. So if you get gallstones and they somehow exit your gallbladder and they get lodged in the pancreatic duct, I believe what happens is that they block the duct, so the digestive enzymes that are normally secreted by the pancreas to digest your food, that these enzymes get activated inside the pancreas, and so they just decide to digest whatever's there, which is the pancreas itself, and that leads to an acute attack of pancreatitis. But anyway, there's many things that can cause it, so that's kind of a misnomer. I mean, it is true that alcohol is probably like the single largest risk factor and or cause of this particular disease, but there are also many other factors that can cause both acute pancreatitis and chronic pancreatitis. So it can be a real problem. A lot of people with chronic pancreatitis, in addition to having to deal with pain and things like this, they like in my case, I take a digestive enzyme called creon, because one of the functions of your pancreas is to secrete two enzymes. One's called lipase and the other's called amylase. And you need these enzymes in order to be able to absorb the vitamins that are fat-soluble vitamins like vitamin D. And so sometimes when your pancreas becomes so damaged, it doesn't produce these enzymes anymore. So you have to take medication to supplement that. And then the other really big problem is that, particularly in the later stages, a lot of people that in particular have chronic pancreatitis will develop diabetes, because the insulin producing cells in the pancreas have also been damaged, and so they become diabetic. So it's a disease that's very complex in nature, both with regard to what causes it and also with regard to the different the different complications that it can cause. So, but I wanted to give this update because I talked about this several years ago. In my personal case, I'm actually doing okay. I'm seeing a doctor regularly, and so having my care managed, and it's not, I mean, it is a problem, but it's something that's manageable. But I have seen this trend in the last few years where some of the people that have the more severe cases, in my opinion, are kind of being pressured into doing these really high risk procedures, and that you just get to the point to where you'll do anything to get out of pain, and they're having really bad outcomes. So if you know somebody that has this issue, or if you yourself do, you might want to do some research before you make any decisions that could affect your long-term health. And I just wanted to make that update. And again, when I saw the article about Robby Steinhardt, because Kansas was a group that I really like listening to and still do. So anyway, that's my update on that. So we'll see you next time.